Okay, first question. A client with a history of abusing barbiturates abruptly stops taking the medication. So, a client with history of abusing barbiturates, okay, he is taking it, he is misusing those barbiturate drugs. So, abruptly he stops taking the medication. So, what will he experience? The nurse should give priority to assessing the client for. So, for what we should assess, we should give the priority. A. Depression and suicidal ideation. B. Tachycardia and diarrhea. C. Muscle cramping and abdominal pain. D. Tachycardia and euphoric mood. So, in case of barbiturate withdrawal, it's like alcohol withdrawal. So, sudden CNS excitation occurs. Sudden CNS, central nervous system excitation. So, everything will be more, every symptom will be exaggerated. So, the answer is, so patient will be having tachycardia, diarrhea, seizure, hypertension, tremors. Okay, so here the answer is tachycardia and diarrhea. Okay, all these symptoms are due to barbiturates withdrawal. During assessment of a laboring client, nurse notes that the FHT, fetal heart rate, are loudest in the upper right quadrant. Upper right quadrant, the infant is most likely in which position? So you have to know in case of vertex presentation, baby's head will be down and bump will be in the upper portion, right? In case of breech, the baby will be having head in the upper side and bump in the lower. Okay, so in case of vertex presentation, the heart rate, you can hear the heart rate clearly below the umbilicus. Below the umbilicus, you can hear the heart rate. Below the umbilicus, heart rate will be clear. In case of breech, a heart rate will be above the umbilicus. So here in question, upper, so upper in the sense anyway breech presentation, okay, right, so right side. So if the baby is turned to the right, so that we can hear it clearly in the upper right quadrant. So option A, right breech presentation, right occiput anterior presentation, it won't come. Left sacral anterior presentation, no. Left occiput transverse presentation, no. So answer is right breech presentation. You can take hint from the question. Okay. And the next question, the primary physiological alteration in the development of asthma. So when asthma develops, what will happen? What alteration, physiological alteration will happen here? So option A, bronchial inflammation and dyspnea. B, hypersecretion of abnormally viscous mucus. Infectious process causing mucosal edema. Spasm of bronchial smooth muscle. So the first and foremost alteration is that in case of asthma is narrowing of the airway, right? Narrowing of the airway so that air cannot escape. Only very little air can travel through this space. And that's why we hear the sound called wheezing sound, right? So here the answer is spasm of bronchial smooth muscle that causes narrowing of the airway. Okay, after that inflammation and edema happens. A client with mania, okay, is unable to finish her dinner. Yes. To help her maintain sufficient nourishment, the nurse should. So for mania patients, they won't be sitting in a single place. They'll be hyperactive. They'll run, okay, jump. They can't sit in one place and eat the food properly. But still, they also should need the nutrition, right? So A, serve high calorie foods she can carry with her. Encourage her appetite by sending out of her favorite foods. C, serve her small, attractively arranged portions. Allow her in the unit kitchen for extra food whenever she pleases. So the thing is, main thing we have to remember in case of mania patient, we have to provide finger foods. Finger foods in the sense they can carry and run anywhere. So while running itself, they can have the food. Running or walking, wherever they go, they should carry the food. So we have to give that type of food to that patient, and that food should be rich in nutrients like carbohydrates, calories, protein, and all. So serve high calorie foods she can carry with her. This is important. Okay, encourage her appetite by sending out her favorite food. Even though it is favorite food, they won't complete the meal, and we can't compromise the nutrition also. Okay, serve her small, attractively arranged portions. The main thing is they won't finish the meal properly. That is the main thing. So how to prevent that? Okay, it's not about giving extra food or something, it's about finishing the meal properly. Okay. Next, a 72-year-old male patient with a history of atrial fibrillation and controlled hypertension has been initiated on warfarin therapy. And when we hear about it, we have to remember all those concepts regarding warfarin therapy. We have to monitor PTINR. Yes, we have read it in our previous video. Okay, and the INR should be 2 to 3, not more than 5. It is dangerous, high risk for bleeding. So all those concepts you have to remember. The patient also has a recent history of peptic ulcer. Okay, which instruction should the nurse prioritize during discharge teaching? A, report incidents of diarrhea. B, avoid foods high in vitamin K. C, use a straight razor when shaving. And D, take aspirin for pain relief. So aspirin will be risk, right? It will also lead to bleeding. And straight razor when shaving, they should not use a razor for shaving. It may also cause injury or and lead to bleeding. Avoid foods high in vitamin K. Yes, actually, because it will affect the effect of warfarin, because vitamin K is the antidote for warfarin. Next, report incidence of diarrhea. So the answer is avoid foods high in vitamin K. So it will affect the effect of warfarin. So we have to avoid the. Next question, in a busy surgical unit, a nurse is preparing to insert an IV catheter for 33-year-old patient with a notably hairy forearm and sensitive skin prone to irritation. So how should the nurse manage excess hair at the insertion site? So how do we remove that hair to establish the IV line? A. Leaving the hair intact. B. Shaving the area. C. Clipping the hair in the area. Removing the hair with depilatory. So he also has sensitive skin. So shaving and this will irritate his skin. Okay, also shaving is prohibited, right? Nowadays we don't shave the patient's hair. Leaving the hair intact, this will affect the insertion, IV catheter insertion. Now, is so we can't leave that also. So clipping is the best idea. Clipping the hair in the area is the best idea. Sterile clipping is must. Next, a 63-year-old female patient with worsening heart failure presents with shortness of breath and cough that worsens when lying down. Cough that worsens when lying down. Which breath sounds are most likely to be auscultated? Okay, so A. Tracheal, B. Fine crackles, C. Coarse crackles, D. Friction rubs. So here you need to know, in case of heart failure, the classical sign is orthopnea. Orthopnea plus SOB, shortness of breath. Okay, also plus fine crackle. So this is the classical sign of heart failure. Orthopnea, patient will be dyspneic uh, in the lying position, and yes, they'll have a shortness of breath plus fine crackles. So the answer is fine crackles. Next, after insertion of chest tube for pneumothorax, a client becomes hypotensive with the neck vein distension and tracheal shift. It is dangerous. Tracheal shift and neck vein distension is dangerous. Which cause of tension pneumothorax should the nurse check for? Okay, what should be the cause here? A. Infection of the lung. No, actually they have kept chest tube, and by from the question we can understand some neck vein, jugular vein distension plus tracheal shift. If trachea is shifting to one side, it definitely means some pressure change happened in the lungs. Okay, due to the pressure change, the trachea gets shifted to one side. Okay, so it's not about infection. B. Kinked or obstructed chest tube. C. Excessive water in the water seal chamber. It won't be the cause. Excessive chest tube drainage, that also won't be the cause. Some obstruction might be there. That's why pressure gets developed inside the lungs and tracheal shift happens. Vivid dreaming occurs in which stage of sleep? Vivid dreaming is, it's like a scene. Okay, some film like dream happens. So that happens in which stage of sleep? Okay, we have already read about the sleep cycle. So this kind of sleep happens with stage 1 non-REM, REM, stage 2 non-REM, and delta stage. So this vivid dreaming occurs. Remember, this vivid dreaming occurs in the random eye movement sleep. In this sleep only, in this stage of sleep only, we'll get film like dreams. Okay. The natural sedative in meat and milk products that can help induce sleep. Okay, in meat and milk there is a sedative product, okay, that helps to induce the sleep. So what's that? A. Flurazepam, B. Temazepam, C. Methotrexate, tryptophan. So here meat and milk products have a product. Meat and milk products have a component called tryptophan. Tryptophan. And this tryptophan will be converted into serotonin. And this serotonin will be converted into melatonin, which is very important for sleep. And this melatonin will induce sleep. Okay, so meat and milk products have this tryptophan which will finally be converted into melatonin, which will induce a sleep. So the remaining question we'll be discussing in the next video. So bye bye.